Xanthelasma. Xanthelasma is an indication of high blood lipid levels and has a high risk of ischemic heart disease, and it is possible that if it were an indicator of high cholesterol, it could be associated with an early death. Xanthelasma, a yellowish coating that forms on the surface of blood vessels in the central nervous system, CNS, of people with coronary heart disease, CHD, appears as a white, yellowish brown or red-orange yellow coating. The color of the coverings can vary from soft to hard and calcareous, although the variability is usually due to the chronicity of these coverings. Xanthelasma, also known as Xanthelasma palpebra, is a well-defined flat, slightly elevated yellowish growth that typically occurs on the eyelids. It develops in people with high blood lipid levels and high cholesterol and can also develop in people who have developed a high risk of ischemic heart disease, CHD, or other heart disease. Although there is usually no clear clinical diagnosis, small studies suggest that xanthelasma may even be the result of a combination of factors such as high blood lipids and high cholesterol, even though cholesterol levels are normal. About half of all patients with xanthelasma have elevated lipid levels, which are often associated with hereditary heart disease, CHD, and other heart diseases, and about half have hereditary coronary heart disease. As a result, cholesterol deposits can accumulate under the skin and cause the growth of the lesions. These bumps could be a sign that your health is at risk, but they are actually cholesterol deposits known as xanthelasma, and they could be signs of a health problem. Doctors believe xanthelasma manifests in the form of growth on the surface of the skin, usually in areas such as the eyes, nose and mouth. Basically, this growth is a skin area where cholesterol has accumulated and concentrated, says Dr. John Reed, an assistant professor of dermatology at the University of California, San Diego School of Medicine. He says when this happens, cholesterol seeps from the skin into the area where it forms an elevated stain. Xanthelasma is a skin condition characterized by oily growths on the body but not harmful. Although the growth is considered unsightly, it can be removed even if it can be considered unsightly with Xanthel, a dedicated treatment, designed especially to remove xanthelasma and xanthomas. Eyelid contractions can occur as a result of xanthelasma lesions as they occur in the eyelids. Eyelids with contractions, ectropions and malformations of the eyelids can also occur due to the presence of a large number of lesions on the outer eyelashes. Xanthelasma can also be present on the face and affect the aesthetic appearance of your face, as there are a large number of lesions in the outer eyelashes of the eyelids. Xanthelasma may indicate possible problems with liver or pancreatic function, but no further treatment is recommended. If you notice yellow spots around your eyes, this can be a warning sign for your health. Xanthelasma itself does not pose a risk to the eyes, and does not cause any problems with eye health or vision, but if you want to remove it for visual reasons, then use Xanthel, the professional xanthelasma removal cream. Xanthelasma is a yellow cholesterol coating that is deposited in the circulation system and causes cholesterol to come into contact with the skin and cause increased skin spots. Many studies show that cholesterol is broken down over time in capillaries. In some patients, xanthelasma is so severe that it produces an unsightly appearance that is difficult to conceal with makeup. As a result, patients hide behind glasses and have low self-esteem, depression, and social isolation. Some treatments tend to work well, such as using anti-inflammatory drugs and skin creams, but some don't. The most effective is Xanthel, with it being used worldwide with fantastic results. It's the professional choice for xanthelasma and eyelid xanthoma removal. Find out more at xanthel.com.